Okay, today we're going to start talking about human lifespan development. And when we're talking today, basically what we want to go over is the differences from everything from infants to the geriatric population, which there's a lot of changes, and our biggest changes we're going to see is actually going to be in our pediatric population. Those are going to be the big aspects and a lot of different changes, so we'll spend a lot of time on that today. And here's kind of the different ranges we're looking at. So infancy to birth, to 12 months. Toddlers are the 12 to 36 months. You can see kind of the ages in here. And as we change into each of these ranges, pretty much all the way up to adolescence, there's significant changes in respiratory rate, vital signs, growth and development, anatomy on them. And so those are going to be important factors for you guys to know. And obviously just here taking a look of the different stages potentially of patients that we're going to see. So again, pediatric population is going to be our greatest change, especially in our vital signs. So these are going to be all things that we're going to expect you guys to know. It takes a while. Hopefully a lot of you know this already. If not, this is going to be something that'll be very important to know what normal is. You're going to hear me say this a lot in classes and lectures and in labs, is it's more important to know what normal is than to know what abnormal is. If you know what normal is, then you're going to really know, hey, wait a minute, this is outside the range. This is not normally what I expect. So here's just this page, and then the next slide is going to be a table that I think you guys really need to know, especially as when we're referring to vitals and what to be expecting from each of those. And then you can see, obviously, as we get into the adolescence to adulthood to geriatric, there's not going to be a lot of changes, and that's going to be the easiest as population is what we expect. But again, the pediatric is where we're going to spend a lot of time with this. And so, again, right in here is looking at what heart rates are. So obviously when we're dealing with a infant, newborn, neonate, however you want to classify that, having heart rates up to 180 beats is within the normal range, especially for an infant just born. As opposed to an adult, obviously, we're going to be looking more into the SBT possibility of ranges that we're at. Even sitting at about 120 beats, we're talking sinus tach for the adults, where that's going to be normal for some infants and neonates. So knowing what those are. Respiratory rates, again, our big one is knowing when do we need to bag that patient. What is within normal, what is acceptable. All these things are very important to know, and going to expect that you guys do know these, especially in the scenarios that we're going to be given to you. And then knowing what the normal blood pressure is related to there. So I'm going to give you guys a couple of different things as far as figuring out blood pressures, especially for young kids. And realistically, where we go is you can use either 70 or 72 have been pretty much the two numbers that I've seen in different texts and articles, plus the patient's age. That would give you a systolic blood pressure area, a low range of systolic blood pressure that would be equivalent or acceptable. So you get a 2-year-old, a systolic blood pressure of 72 to 74 is acceptable. Now, granted, we're hoping they're closer to, 90, things like that, but it's basically their age plus 70 or 72 gives you at least a normal with systolic. Below that is going to be an abnormal reading. That's kind of the lowest acceptable systolic readings. So other aspects we're going to be talking about is what their weight is, how much the child is expected to grow from birth once they go home in the first month, in the first 3 months, in the first year, and kind of knowing what those weights should be. And granted, there's going to be some big changes between kids, but normally one of the things we'll see is after birth, the child usually drops weight in the first week going home, and then we'll start to double and go from there as we get into later months. So those are all important aspects to kind of get just a general idea, as if we're having a patient who's having a problem, failure to thrive, or we've got someone which is in the normal range of what to expect. So that's kind of what we're going to be looking for. And again, knowing more what normal is, then you're going to know what abnormal is. That's an easy way to start. Obviously, we want you to know everything, but at first, know your normals. Know everything from there, and then you're going to know when something is abnormal and be able to figure out what it is from there. In development, and you're going to get this in Dr. Edmister's lecture as well, talking about the ductus venosus, the foraminal valley, and the heart, and basically how those things are going to change from how blood flow is coming into the child in uterine versus once they're been born, those changes that we're going to see of closing everything off and starting to actually use the lungs and the respiratory tract instead of bypassing that. And then blood flow going from just arteries equally and down to the valves now to be closing off that break between the right and left atrium. So all different things that we're going to be able to see and how that goes. Once we get that area where the baby takes its first breath and starts breathing oxygen into there, it's going to close off those areas. And we'll also talk about later when we get into more cardiology, some of those abnormalities that can still happen when something doesn't quite close off or something doesn't quite work the way we're expecting. Again, you know what normal is, you're going to figure out what abnormal is. So as you can see, basically this is the aspect of where the baby's been not breathing and getting total oxygen exchange has been pretty much coming from the umbilical cord. Now once we get that birth and we get that area that baby takes the first breath, that's going to blow up the lungs, fill that up. And once that does, then that's going to be the cue for the lungs to secrete surfactant. Surfactant is going to be that chemical almost basically that's going to fill up each of the alveoli and help maintain those positions and help it maintain opening. Imagine blowing a balloon up where that first forceful area to get that past where the balloon starts to open up. Then surfactant's what's going to keep it open as opposed to collapsing on itself. And it's going to reduce that the ability of the lungs to collapse. And we'll talk about atelectasis later on, which is a collapsing of those lungs. And what removes the surfactant, but that's really the process that's going to be happening. Some of the differences that you're going to see immediately is the airway. Airway in a child, a couple of different things we're going to be looking at. Well, one, the head's going to be bigger, so positionally when they're laying supine is going to potentially obstruct that airway. The airway is shorter, it's narrower because of their size. It's less stable because it doesn't have cartilaginous rings around it supporting there, so it's easily able to compress, become obstructed. Most of the time they're not going to be breathing through the mouth, they're going to be really nose breathers, and because of how their body is not developed yet, they're going to be belly breathers, they're going to be using accessory muscles, they're going to be using grunting to get air, a lot of different things that they have to do, especially as infants. We're going to see their chest wall is less rigid. Obviously there again they're going to be more cartilaginous and not fully had the osteocytes and osteoblasts fill and form bony. They're going to be very cartilaginous. How the ribs are positioned. Kidneys are going to be just starting to work and they're not going to really able to be in full function yet as it's growing. And then they become kids and geriatric population you're going to see are very close to what happens there, and they're both areas that can become both populations that become very easily dehydrated. So we've got to be watching out for that as well. Most of their immunities that they're going to be doing are acquired initially through the umbilical cord. We're going to talk about breastfed babies versus those on formula, and they say you're passing a lot more immunities that way. So these are going to be just some other aspects in here towards that development of the infant into growing into a child. The other thing that we're going to see is the moral reflex or the startle reflex. And you maybe have seen this if you have kids or have nephews, nieces, anyone you've been around, you'll see that area where they will startle easier, the arms will go wide, the fingers will spread, and then they'll grab. If you put your finger into the palm of a baby, the instinct is going to be to grab it, squeeze very tight, and then you'll see that will kind of let go from there. But you're going to see that quick reaction. That's what the palmar grasp is that I was just talking about. And then it kind of weakens about over time, but that's going to be kind of one of those instincts you're going to be able to see of how responsive that patient is by putting a finger into their palm, and if it grabs quickly, that's going to be a normal response. If they don't and they're more no response to it at all, you're going to know that's not a normal response and be looking for other things. Again, going back to my statement previously of looking for what is normal. Other development areas you're going to be seeing here, again, the rooting reflex and the sucking reflex, as you can kind of see. And this is going to be the instinct for the baby to start feeding. The fontanelles on the head, this is going to be able to tell us a lot when we're really looking for a dehydrated baby, or if we're looking for intracranial pressure, encephalitis, other different things out there. We're going to be looking around those fontanelles because that's where a lot of fluid can go, because the fontanelles have not fused yet to form the full skull and cranium. So you're going to see that little hole in the top of the head, and when they're dehydrated, you're going to be able to see it drop down. When they have encephalopathy, increased intracranial pressure, you're going to see that area bulging on there. And that's going to be another indicating factor when they're young of whether we're dealing with intracranial pressure or we're dealing with dehydration. Their normal sleep developments, and again, this, I have to take this with a grain of salt because I've had 2 kids and they were completely different on their sleep cycles of where they are. And those of you who have had kids may have had this where some have been sleeping through the night and some only sleep in 2-hour periods. So it just really depends. And so there's no hard or set fast rule with sleep patterns on these. They are going to be different. And then how they grow and factors in development, they talk about here. So I'm not going to get too much into this portion right now. There are going to be rapid changes, in those first 2 months where they start tracking objects, they start recognizing people, how they respond. The big thing is when we get into a little bit older ages, is what are the normal type of responses when they're around people? What are the normal actions? And we'll get into that as we get up. Still talking about the infancy though. Again, this can vary so much in here. So just kind of take this with a grain of salt of what you expect. Take it from your experiences here. But again, at 5 months, sleeps through the night without waking or feeding. Well, I had my first who did that at 3 months, and I had my second child who didn't do that until like 9 months. So again, take everything with a grain of salt of what you're doing here. So I'm not going to go too much over these areas here too. And at 7 months of age, my kids were not fear of strangers at all. So hard to say. Again, reactions. So take all these with a grain of salt. When they speak, when they walk, all those different things are going to take different times, and different kids are going to advance at different moments in time. These are just generalities on here, and going all the way up from 11 months to 12 months. So again, everything's going to be a generality of how their development is, what they're exposed to. A lot of differences in here. So again, take these with a grain of salt. Now the psychosocial development, basically this develops as to the reactions, the environments, the socialization, I can't speak today, sorry, of what the child is exposed to. And so this is going to vary from infant to infant. How the baby comes in crying, obviously, is their only way usually of communicating when there's something wrong. That's usually there, and that's the hardest part of trying to diagnose a lot of these things, when they can't talk to you and tell you exactly what's wrong, and a very difficult part of pediatrics, and how they respond there. So here's basically, again, take a look at this. Read everything with a grain of salt. I'm not going to get too much into this aspect. It does vary a lot from family to family and from child to child from there. So I'm going to kind of just skip off of some of those areas. These are just other development. I hate getting into the psychosocial. It's not my area of expertise, but this is just kind of talking about some aspects of how the children grow, what they develop on, and how they develop their perception. Scaffolding, building on what they know. Again, this is probably something we're not going to be testing you on or anything like that, but just being aware of how there's differences in society between how children's come. And again, in between family and that, of how the children warms up, how they are as far as parenting, what their environment is, and how they're treated, raised up. So it is going to be very. What I want to get into more is this stuff, into the vitals. That's the more important aspect that we'll be dealing with. And what I want you to know is, again, this is the rate for toddlers, the vital signs, what to expect on them. So what type of vital signs do you expect, and what is the interactions you expect to have with each of those? So obviously dealing with toddlers, this is about the type age and appearance on here that we're looking. They're able to stand, they're able to move, they're crawling. Preschoolers is more to 3 to 5. You can see their heart rates, 7110. We're starting to get more to what a normal adult is. So we really start with those high heart rates, high respiratory rates, low blood pressures, and then we're slowly kind of building up. The heart rate goes down, the blood pressure goes up, and the respiratory rate is going down. So those are kind of some areas, and then getting us some idea of what their weights are. Those are going to be a big thing of identifying how much a child weighs, how much an adult weighs, especially as we get into drug calculations and weight-based calculations. They're going to be developing more with their lungs, their muscles. It's slowly developing up to those adult ages. They're still going to be tiring really quickly at those ages. That toddler still would say talking naps because they're still going to be growing quite a bit and can develop in height and weight very quickly over a short time frame. Now the kidneys becoming developed. This is a time too when the toddler and preschool age, they're exposed to a lot of potential infections. So we see these kids getting sick a lot. And this is the time they're really getting those active immunities versus the passive immunities. Passive immunities coming from mom, from either breastfeeding or from the umbilical cord, to now the active immunities where they're getting exposed to colds, infections, things like that. This is also the time we do most of our vaccinations as well, because during this period they can actually build up immunities much stronger than later on in life. And then kind of some more development areas of where they are as far as language, and that get varies so much from kids to kids, but these are pretty much the averages of what to expect. And you can see from here different aspects in based on their ages of where they're at. Playing simple games, following basic rules. Big thing to know on here is that's how to work with these kids, is playing games with them sometimes. And games may be as simple as, this is the type of kids when you're trying to listen to lungs, you're trying to get blood pressures, that maybe you show them to do it on you. And this is kind of that back and forth type of thing of gaining their trust and allowing to do it. Some kids will allow you to do blood pressures, listen to lungs very easily. Some you got to work with a little bit, and playing a little game with them of how you get to be able to get some of their vitals. Again, it's also based on, you know, how they're doing and presenting and what kind of situation it is. Again, more is part into this psychosocial development, which we're not going to get into the testing aspect. Our concentration is going to be more on vital signs and interactions is going to be the big thing. That's going to be the important part to know. And again, I'm going to just kind of skip over this area. You guys can read there. Not really getting into that. This is not a testing area, not anything like that we're looking for. We're looking on what the children are, how they're going to react, what to expect. Again, what should normally you see when dealing with a toddler or preschool age? What should be our normal vital signs? Those are going to be the big things that we're looking to see and where they're at. So that's kind of be where I'm going to focus, where I'm not focusing on this kind of stuff. So, and I'm not going to get into this. As you can see here, you can read across this. I'm going to leave that up there for you to read and say there. But again, I'm not going to get into that aspect. That's not really my area of expertise. This is the area of that, again, where I want to jump in now to, again, school age. You can see the heart rate, again, slowing down, respiratory rate slowing down, blood pressure going up, and about how much they're going in height and weight and what to expect in development. This is the age too we start seeing, especially later toward the end, becoming awkward and growing into their bodies. This and the next stage, you're going to see that. So you're going to see a lot more of traumatic injuries, of just sometimes clumsiness and growing into their body, especially when they grow overnight a huge amount, and then getting used to that. So where they are as, again, their confidence level, how their interaction should be with you, what to expect. Again, these are all different things here. And again, the psychosocial portions, I'd like to take those, and leave that to you as a grain of salt from there, because I'm not really getting into that aspect. I know I keep saying that multiple times here. So this is kind of the what we're looking at as far as the size of that age and becoming active. As we get into adolescence, again, we're almost back to what we expect with the adult heart rate. We're getting close into their respiratory rate. We're pretty much right within normal there. Blood pressure range, we're right there in the normal there, and how they act. Now the difference here, especially in the adolescence and sometimes in that preschool development age, is those areas of respect towards the kids. They're going to be more conscious of their body and their development, and so you got to be very careful with your assessments, especially on young girls and that, what their development and what how you can approach them. This is also going to be the area where kids, a lot of times, to get questions out of them, you may have to take them away from parents, as opposed to the young kids, you actually want to be in parents' laps to get the information out that you're looking for. So with a lot of changes, again, the big thing is pulling them aside sometimes, or getting parents out of the room to ask them other questions. So you can ask the child, hey, I'm just getting this out, I'm trying to help you out, what's going on? So you can talk to them in private, and you can find out a lot more information from them. Again, looking out for their best interest, and sometimes you need to do that, to ask those questions. And then, like I said, the body image is a concern on there, so it's showing respect for them and that aspect. We're also getting into this. Haven't seen it as frequently in males, more commonly in the females, but the eating disorders. But we see areas where depression and suicide is a huge area that we're always dealing with, and we got to be cognizant about. And that's where you got to spend the time of delving into this, especially if someone has a potential, or parents are calling for the potential of a suicide there. So take these very seriously, with bullying that's been going on and other different things that we see, unfortunately, more frequently, or at least more recognized out there than maybe years past, of really keeping an eye out that and looking out for those patients. As we get into early adulthood, again, these are the normal rates we're used to. As far as we're looking at heart rate, respiratory rate, blood pressure, you guys should be very familiar with these and know exactly what to expect. So in this area here, a lot of things that we'll get into is, as we coming up, this is going to be the highest population in here, usually where we're going to see childbirth. This is going to be a lot of stress-related injuries, job-related injuries, different things like that we're going to be looking at. As we get to the middle-aged adult, again, heart rate, respiratory rate, blood pressure are all going to be about the same. This is where we're going to start to see some other changes. We're seeing people generally staying healthier now in these ages, whereas before we saw a lot of significant changes health-wise years past. But this is where we're going to start to see cardiovascular instances, high blood pressure, a lot of different things coming into place that will be effective, liver disorders, kidney disorders, all these things since we start coming this age. But we'll see people are becoming more active later in life than had been previously, and people are staying healthier. We are unfortunately seeing higher cancer being diagnosed in this age. It's unfortunately across the board of all ages, but we're seeing it more in this age. People, again, are becoming more conscious of physical activity, and weight control is going to be a thing we're seeing a lot more people focusing on now than maybe years past. When we get into the older ages, again, late adulthood, here's where we're going to see some people stay very healthy into their 90s with no problems. A lot of people, though, we're going to be looking at multiple changes. Polypharmacia, they're going to be on multiple different medications in those, and so we're going to do a lot of different scenarios with a lot of different medications we're going to give you to kind of get used to that and what to expect. As we get in here, though, and the adulthood, it's the same as the geriatric. Here's where we're going to see a lot more problems trying to diagnose things. We'll see a lot more neuropathies as they get older in age. Or basically their inability to feel pain in certain areas and nerves kind of dying off. So a heart attack in a 40-year-old may present as extreme pain substernal, whereas late adulthood, they may have these, quote, silent MIs where they're not even feeling pain. So a lot of different things we're seeing. The muscles have been usually sometimes cannot be as strong. The valves start wearing out in there. Arteries can be blocked over periods of time. Volume decreases, all sorts of things that can be happen. And there was a huge population of smoking quite a while that is now getting to those older ages. So we'd be looking for a lot of COPD or emphysema, a lot of different respiratory diseases as well with this. Other changes that we're seeing on here, as you can see, we'll get patients that have lost their teeth. And so we're dealing with a lot of airway issues of what they're able to eat. And we're going to look for maintaining bag valve mask, and we'll talk about that on someone who doesn't have dentures in place and did that recently. So taking a look at those. We're not going to unfortunately play this video, but we're going to do, when we do a geriatrics class, more towards the fourth module, we'll talk more about pharmacology and what we're dealing with the adults. Other changes that we're going to see with them is their metabolic rate is going to decrease. Their kidneys are going to be decreasing times. Again, generalities over there, not going to be everyone, and how they respond. So a lot of different changes, as you can see, as you get older in life. And we're going to be, for myself up at District 8, we see this a huge population because we have a great area of adult assisted living. This is going to be majority of the calls that I run on. We'll see what you guys do and based on your areas, but it's getting to be a bigger issue, and as the baby boomers are becoming later in life, it's a huge population, and that's where most of our calls are really going to be in this geriatric population. So we're going to spend a lot of time in classes and scenarios and going over what to expect and how to treat them from there, because everything's going to be changing on them. We're going to get a lot more, we've been dealing with a lot more dementia patients, things like that. So it's all about how you can react to them, how to adjust, and again, finding out what normal is and what to expect. As I'd said previously, though, we are getting people staying more active later into life than previously was done. So we are finding, hopefully people are living a little bit longer, they're taking care of themselves better and lasting. The other aspect we're seeing is home care services. I see this a ton in a lot of areas where people are not necessarily going just to assisted living, but they're small home care services where they're coming out and taking care of people in their own home, able to live there, as well as these small homes that are basically taking people in just like an assisted living area. So a lot of different areas that you can come in. Up in Colbert area, there's a ton of these homes that are in normal residences that you walk into, and you'll find out there's probably about 10 patients staying there. So knowing these areas, you're going to know your, for a lack of a better term, your frequent flyers in your areas that you work and where you're going to be going. And they're going to see a lot of these changes, and again, more people in assisted living as we go on, and these baby boomers get in there. Now, this is another issue that we're seeing as we're getting those patients who've retired. Unfortunately, for those of you who have been out in the stores, you see the Walmart greeters that are 90 years old, it seems like 80 years old. People are having to work into their retirement because Social Security just isn't covering it. I see a lot of people are put on medications and they're expensive, and some people have chosen their medications over food or food over medications. So there's a lot of this that we're seeing here, and hopefully this is where we're able to involve the CARES team when we're going out to some of these homes and we see people who look like they need help because they're not being able to keep up on their meds, their home living situation, a lot of different things, and that's another part of our job is we got to be looking out for them and seeing what we can do to help on the long term. Other aspect here, and unfortunately parents do this on a weekly basis almost, it seems, where it seems like they're going to a funeral for someone's friend. But this is going to be a huge aspect, especially when you've had husband and wife, one of them dies. dealing with the grief and dealing with passing that on is going to be a huge aspect as you as a paramedic. We'll talk a lot more about death and dying and that approach, but it's the paramedic that after someone's died has got to go talk to the family. And maybe a lot of you have not done that yet. So that's another thing I want to push and focus on is throughout this next 6 months, I really want you, if you're on a call where someone has passed and the paramedic is going to talk to the families, maybe stepping in with them, listening to what they say, how they react. Obviously, the way I say it may not be the way you want to say it. The way your paramedic that you're working with now says it may not be the way you want to say it. But listening to that and finding a comfortable way to put it in your own words, because you'll find it's not an easy thing to do. There's never the right thing to say, but trying to find a process to talk about that, and we'll talk about more of that in class and other scenarios. So realistically, summary on this area here, my big focus is knowing, based on developmental age, where should this patient be as far as vitals, as far as interaction, as far as responsiveness, and what is the normal for that age and what to expect. Again, the more you're going to know normal, the more you'll know when something is abnormal. So those are kind of where I really want you to get out of this lecture and focus on that, and that's what we're going to do as we get into some more scenarios with this, is knowing what is the normal vital signs and the normal way that this age group should interact. And that'll be the big focus. That's what we're going to test on and hopefully prepare you for, so when you're out there 2 o'clock in the morning going on a 3-year-old, you know exactly what to expect on that and what the normal should be, what their normal respiratory rate is, and is this patient breathing within the normal, heart rate within the normal, blood pressure within the normal, or is this going to be more of a issue that you're realizing that I got to develop, investigate more and find out what's going on. All right, thank you guys.